Medical tips for jiu-jitsu students aged 40 and over. Medical tip number 1, a yearly in-person physical examination by your provider. This will evaluate your overall health and evaluate for any medical conditions that have developed that can impair your performance on the mat. Vital signs to include resting blood pressure, uncontrolled hypertension can impair performance on the mat. Resting heart rate, excessively slow or excessively fast resting heart rate can impair performance on the mat. Listening to the heart, lungs, etc. Yearly labs to evaluate for any metabolic contribution or medical condition that can impair performance, such as anemia, prediabetes, otherwise known as impaired glucose tolerance, liver and kidney dysfunction, fast or slow thyroid function, electrolyte disturbances such as high or low sodium, potassium, etc. A medication review. Many older students are on one or more prescription medications. Dozens of common medications have side effects that can impair performance on the mat. For example, an older student who is on a beta blocker for hypertension, for high blood pressure. Two of the most common side effects are fatigue and a throttling back of the resting heart rate and maximum heart rate. These two side effects can impair performance for a student who is on a beta blocker. Other older students are on a statin for hyperlipidemia, elevated cholesterol. Two common side effects are myalgia and arthralgia, muscle aches and joint aches. There are jiu-jitsu students on statins who ache excessively after hard training sessions. Medical tip number 2. As older students, we must focus on a clean diet, proper hydration, and proper sleep. As older students, we cannot get away with the things we did when we were 18 years old. Medical tip number 3. A reasonable off-mat strength and conditioning program is vital for the older student. We all know that our jiu-jitsu game is a product of our athleticism times our technique. Athleticism including aerobic and anaerobic capacity, flexibility, strength, and power. These parameters diminish steadily as we get older. An older student who is pressed for time or resources can include brisk walks and a quick and dirty strength and conditioning program of push-ups, dips off a chair, crunches, lunges, and squats to try to keep the off-mat strength and conditioning quotient as high as possible. Medical tip number 4, taking recovery seriously. As we get older, we will need a longer period of time to recover from hard training sessions. Respect this. We all know that proper training followed by proper recovery leads to adaptation, the ability to adapt and handle increasingly difficult and intense workloads. This is what we're after. Proper recovery is essential for the older student. Medical tip number 5, attend to injuries immediately. As older students, we already probably have lumbar and cervical degenerative disc disease, arthritis in the knees, hips, shoulders, etc. Attending to injuries immediately for a proper diagnosis and proper treatment plan will get us on the mat much quicker. Medical tip number 6, as older students, we have to keep our expectations reasonable. Expectations as to frequency of training, how often we can make it to the academy with all our other responsibilities, intensity of training, how many rounds we can go hard versus having to flow roll a little bit, etc.